Hi guys, and welcome back to my channel. As you already know, this is your girl Victoria Nzelibe, and today I have a special guest with me. We'll get there, but first, if you are a new subscriber, if you're just seeing my face for the first time, welcome to my channel. My name is Victoria Nzelibe, and my returning subscribers, how una dey now? You already know I love you all. You guys have been so amazing. Thank you for doing what you're doing. So on my episode today, we'll be discussing mental health. It's a very important topic that everybody needs to be aware of. And my guest is a doctor, Dr. Elliot. He's going to see him soon, don't worry. So if you are interested in hearing everything, in fact, you don't need to be interested. It's important. Everybody needs to watch this. Don't go anywhere.
I ain't here for the money, I ain't here for the fame. Though it might be nice to own a jet plane, I'ma do it all for you. Come along and see it's true, but the world is pretty cold. You might need a sweater too.
Hi guys, and welcome back. Today I have a special guest. He's a doctor. No, I don't want to talk too much. Let me just let him introduce himself.
Hi, everybody. Happy to be here. My name is Elliot, and I'm a psychotherapist.
Thank you for being here with me. I really appreciate it. So, guys, today we'll be discussing mental health, and who else can describe it better for us other than our doctor? You've been a psychotherapist for how long now?
About 20 years.
Wow, 20 years. 20 years. So, if you guys feel like you have any other questions to ask me, or after he's answered my questions, you can always leave it in my comment section. I can always reach out to him to answer those questions and get back to whoever asked that question. But anyway, let's get into it. So, Dr. Allen, I want to start by asking you, what are the most cases you've seen during the pandemic with mental health, and what's your advice to anyone there during this pandemic?
Okay, good question. I've seen a lot, in terms of the pandemic, I've seen a lot of uptake in anxiety cases and people suffering from depression. So I would say anxiety and depression, for the most part, has been on the increase, directly related to the virus.
And what's your advice to people during this pandemic? I know people are always going out. I think people need to understand how important it is to stay safe, distance themselves, use sanitizers, wash their hands frequently, use their masks. I think you should just explain to them. Maybe they'll probably listen to you since it's coming from a doctor.
Well, I definitely think it's important. I mean, I want to just disclaimer, I'm not a medical doctor or mental health, but at the same time, I do feel it's important that folks do follow the CDC guidelines in terms of keeping their distance, wearing their mask. This thing is real, it's out there. I've had patients and also folks, family members that I've personally had to deal with who's had it, so I know that it's real. And it's affecting people in every way that you can imagine, economically, physically, emotionally, mental health wise, of course.
Okay.
So it's a real thing.
Okay, I think you should just give us a brief description of what mental health is. I mean, you better describe it better than I do.
Sure. Well, I mean, everybody should have mental health.
Okay.
But there is something that's called mental illness.
Okay.
Mental illness is when now all of a sudden your mood, your thinking, or your behavior starts to change adversely.
Okay.
And it begins to affect your everyday ability to live a normal life. Then we start to look at, well, maybe there's some sort of mental illness involved.
And you said you've had mostly anxiety and depression.
Yes, I've seen an uptake in that, but I treat all kinds of different diagnoses, bipolar disorder, schizophrenia, ADHD, anxiety, depression. There's a myriad of different illnesses out there. The way you would figure out if you do have a particular mental illness is that you need to see a mental health professional, and there's a battery of tests and questions and so on that you would go through, and then the professional would decide whether or not there's a mental illness and at what level.
Okay, what are the signs? What do I start seeing that probably tells me, hey, you need to get this person to go see a therapist or something?
Okay, good question. I think when you start to see changes in someone adversely, depending on what type of mental illness they have, It'll depend on the changes that you'll see on the behaviors. For example, someone who may be suffering from depression, you'll see that their sleeping habits may change, their eating habits may change, their mood might change. It's anything that you see that's sort of not in the normal range for someone, and then you can obviously see that it's beginning to affect them adversely. And communicating with family members or socializing with others in the community, then you know there could be a problem. It should be investigated further.
I mean, now that you've said this possible signs, how do I approach them? Knowing that, okay, I've seen this sign, I know that you might be having a problem mentally. So how do I approach them?
That's a good question. I think that just, someone you obviously care about, so the first thing you want to show them is that you care.
Okay.
Allow them to communicate with you about what their issues are. Just ask questions like, hey, what's going on? If you're lucky, they will begin to communicate with you different symptoms that they're going through.
Okay.
And then from there, you're opening up a dialogue for them to, hey, maybe we should, talk to our primary care doctor. And then from there, maybe we can talk to a mental health professional. There's a lot of different ways to get folks into treatment. But it is a challenge because mental illness does have certain stereotypes attached to it.
Yeah.
And especially in some cultures and some subcultures, having a mental illness is seen as a bad thing. I want to say that having a mental illness is like having any other sickness in the body.
Thank you for putting that out there. There's nothing to be shy about.
No, you're welcome. And I guess if we can look at it that way, sometimes mental illness can be an organic problem, just like any other problem. Like, let's say you have a stomach ache, that could be an organic problem.
Okay.
The brain can also go through organic changes that causes mental illness. So the sooner that we're able to look at it as a illness like any other illness, the better we'll be as a society in treating mental illness.
Do you think mental illness can be hereditary or?
Absolutely. There are a couple of things that can cause mental illness.
Okay.
Hereditary is one of them. Environmental is another one. Even environmentally, even before some folks are even born, if mom was using certain drugs or things like that while a child is in utero, that can affect the child mentally as he's born or he or she is born and grows up. So there's the environmental factor, there's the hereditary factor, and can be an organic problem. Could be chemical imbalance in the brain that causes it, and we don't know. We're learning more about it, but no one really knows all of the factors that cause mental illness.
So if someone said to me, hey Victoria, I'm always angry, I don't even know why I'm angry, like I don't know what's wrong with me, what do I say to that person? I don't want to think, okay, maybe it's just anger or something, but then if someone comes to me to open up to me and say, hey, I'm always angry, I don't know what's wrong with me, I overreact to certain things, do you think it's some kind of illness? Or
It could be. It could be. I mean, it would definitely take further exploration as to the triggers of that person's anger. If it's to the point where it becomes a chronic problem, means long term, and it's beginning to affect their ability to have relationships with people, it affects their relationship with themselves, and how they're treating themselves, their self-esteem, and so on and so forth. Then at that point, I would try to encourage that person to seek professional help. And then from there, the mental health counselor will, explore triggers to the anger, try to figure out what its etiology is.
Right. Thank you for putting that. So I just would love to know, are there certain things you shouldn't say to someone who is mentally challenged?
Definitely, they should not be discriminated against. Yes, don't say you're just crazy or you're weak-minded. Things that sort of put someone down. I think you always want to uplift people no matter what they're going through.
Right.
Be encouraging. Find a person's strengths. If someone's going through something, start off with what their strengths are and say, hey, point out. The point is to get their self-esteem up and to give them enough courage to maybe seek help if they need it.
Okay, so I wanted to ask this. Is it safe to say that people with mental illness know they have it?
I think some folks know, and some folks are in denial. And then some folks, they just haven't been educated in what mental illness is. So when you start to experience certain symptoms of mental illness, if you don't have any sort of education or background on as to what exactly mental illness is, some folks may not know what's going on. They may listen to whatever their culture is telling them, and it's like, oh, I'm just weak-minded, I need to get better. But again, mental illness is a real thing, and it's a big problem in our society, and this pandemic has really shown, I think, uncovered what mental illness, the extensiveness of the problem in our society, and I think that's one maybe good thing in a weird way that the pandemic has done for the mental health community.
Okay, so you said you've dealt a lot with depression. I know that most people that have dealt with depression have probably been suicidal, or they've probably committed suicide. Is there something that triggers depression? Is there something we need to, because I feel like some people can be depressed and they don't even know they are depressed. They just are sad all the time or something. Can you say that there are causes to depression or something that triggers depression?
Yeah, I mean, there could be a lot of triggers to depression. I think the key again is to try to figure out what those triggers are. It could be a chemical imbalance where medication could help. It could be something environmental in someone's life. Research has shown that traumatic experiences can actually change the chemical compounds of a person's brain, which could cause depression and anxiety and some other things. So I think the main thing with depression or any other disorder like anxiety, you really want to figure out what the triggers are, and the best way to figure out those triggers is to get that person to a professional as soon as possible.
So what if the person refuses to go? Do you bundle that person, take them there? What do you do?
Well, some states have different laws. If someone is a danger to themselves or someone else, then some states will allow a professional to have them evaluated against their will.
Okay.
It just depends on states and jurisdictions. But for the most part, if a person is not a danger to them, immediate danger to themselves or imminent danger to someone else, you can't really force them to go. So I always say just start with their strengths and try to, this person needs to see that you're on their side, that you care about them, and just try to nudge them towards seeking professional help. But unfortunately, you can't force somebody to seek treatment unless it's some of the criteria that I just mentioned.
So, what would you advise someone who, or what would you say to someone who is having suicidal thoughts?
Well, the first thing I would do is have a safety plan in place to see, it's one thing to have thoughts and there's another thing to have suicidal plan of action. It's two different things.
Okay.
So somebody could be having suicidal thoughts or just sort of thinking about it, and maybe I'd be better off not around. But then you, as a professional, you want to assess, okay, do you have a plan on hurting yourself? And if you have a plan, how are you going to execute that plan?
Wait, you ask that person?
Yeah, you ask, yes, you bluntly ask, okay, do you have a plan on hurting yourself? And if they say yes, and then they can give you specifics on that plan, at that point you really need to get them into emergency care immediately. Versus someone who may be just kind of thinking about it, they don't have any sort of plan, then in that case, the danger is not as imminent, but you would still want to get that person to see a professional as soon as possible.
Is it possible that someone with mental illness starts hallucinating, saying things that are not happening, saying someone is trying to, kill them or poison them or something like that?
Absolutely. There are several diagnoses that type of behavior would fall under. The most common one known is called schizophrenia.
Okay.
There's different types of schizophrenia. The one that you just described is called paranoid schizophrenia.
Okay.
Schizophrenia is basically a chemical imbalance in the brain. Medication has come a long way in trying to. There's no cure for it, by the way, but medication has come a long way in trying to circumvent some of the symptoms. But yes, people can see things and hear things that aren't there. They can become paranoid. There are other diagnoses besides schizophrenia, but paranoid schizophrenia, but that's the main one that comes to mind when you mention those types of symptoms.
What do you do as the person who is the observer in that situation?
You would have to, again, I know I'm kind of being redundant, but you have to get them to see a professional, and if you, even as a layperson, if you ascertain that they are a threat to themselves or someone else, you have to get emergency services involved to get them to get the help that they need, even if they refuse. But for the most part, the main thing you got to do is get them to see a professional. I keep harping on that.
Well, I'm so glad you were able to do this for me. But before I let you go, I'd like you to give your advice, like just put anything out there. Just tell them how important it is to, be observant, maybe their loved ones or whoever that is going through it, like you said, how to lift them up. I don't know.
Sure.
Put anything out there.
Well, I would say, as a society and in our culture, African American community and African community, let's start looking at mental illness as what it is. It's an illness, just like any other illness. Let's get the people. Let's not discriminate or have misnomers about mental illness, and let's just maybe do some research on it and realize that it's an illness like anything else. As far as I know, there's a pandemic going on. I would say if folks are, first of all, having anxiety because of the pandemic is normal. All of us are dealing with some anxiety, increased anxiety. But if it gets to the point where it's getting out of control, talk to somebody. Telehealth is pretty, I think in most states are allowed, so you can actually talk to a therapist online through video, which is good. Hopefully they'll keep that up. And talk to somebody, try to keep a normal routine, even though most folks are at home.
Right.
Have some sort of normalcy to your routine. Get plenty of exercise, sunshine, water, sleep, all of the basics.
Okay, I said I was going to let you go, but now that you mentioned exercise, water, and stuff like that, are there healthy foods people with these illnesses need to eat, or?
I think so. I think the healthier you can be, the more your entire body benefits, including the brain. So I think plant-based foods, less fatty foods and stuff like that, more sleep, plenty of water, lots of exercise, breathing techniques. A lot of these things I tell my clients as part of their overall mental health treatment plan is to live a healthy lifestyle, eat healthy, exercise, breathing techniques, things of that nature.
Is there a common symptom with all kinds of mental illness? Is there one common symptom?
I think the common symptom is it disrupts your ability to live a normal, happy life. I think that's the common symptom to mental illness. I know it's very broad. There's a lot of mental illnesses, so there's a lot of symptoms out there. But if it gets to the point where it's adversely affecting your ability to live a happy life and your self-esteem and some other things are really affected, and I think it's time to really take a close look at what's going on. But the good news is all these things can be treated. Research shows that psychotherapy, which is just talking to a therapist regularly, in some cases, some folks may need medication, may need to see a psychiatrist. It can really, really help a lot of people.
Well, like I said, thank you so much for being here. Guys, if you love everything you've said in this video, please don't forget to like, subscribe, and share. Leave your comment below if you have any questions or if you have anything to add. Thank you so much.
Thank you. Thank you for having me.
And until next time, guys. Bye.